My doctor needs an excuse to fill my prescription. First of all, your doctor doesn't need an excuse to fill your prescription. They may need a rationale, but there's a lot of rationales out there. So when we're using it for chronic pain, we usually use a chronic pain protocol. There was a study done back in 2007, I believe it was, with Yale University, and it was called the Oxytrex trial, where they used 1 microgram, which is 1/1000th of a milligram, 1 microgram with 5 milligrams of oxycodone, and they actually found that the effects of oxycodone were increased. So the people needed less. And so that study was not fully published. It wasn't finished, but they did hand it over to another entity, which then continued. And we have built on some of that information along the way. So as I stated, Dr. Norman Marcus is with the Norman Marcus Pain Institute in New York. And his published protocol that came out earlier in 2024, he literally starts at 0.1 milligram, which is 100 micrograms. And he does that for 2 days. And then he does it twice a day for 2 days, then 3 times a day for 2 days, 4 times a day for 2 days. So now we're 10 days deep. And then he starts to increase to 0.2, 0.1, 0.1, 0.1, and then 0.2, 0.1, 0.1, 0.2, and increases for that. So that inside of 16 days, you're now at 0.2 milligrams 4 times a day. When he is working with patients who have chronic pain, who have had chronic rangeal pain syndrome or Ehlers-Danlos with significant pain, he has found tremendous success. Maybe not 100%, but pretty darn close. And sometimes it is a patient variable that he's not able to fully get to 100% effectiveness. And what I mean by that is that sometimes patients are just not patient enough and they don't want to wait, that they just want things fixed right now. And so they want to dump LDN and go back to their opiates. But to that, I'm going to say most of the time, opiates, they don't necessarily give you 100% relief either.